Welcome dear students. I am Richa Shakya, Assistant Professor from Noida Institute of Engineering Technology, Pharmacy Institute, Greater Noida. Today I am here to deliver the lecture from the subject that is a pathophysiology, and the subject code is BP204T, and this subject comes under the Dr. APJ Abdul Kalam Technical University of the B Pharma course, right. So, in the previous lectures we discussed about the bones disease, right. So, in the today we discuss about what is osteoporosis, what is gout, and what is the pathophysiology behind both of the disorders and how it will be treated, right. So, this is the in this lecture at the end we discuss about the entire pathogenesis, pathophysiology and the medication regarding with the osteoporosis and the gout. So, now start with the introduction session. So, basically what is osteoporosis, right. So, when we discuss about osteoporosis, so first is it is described the osteo means bone and porosis means density, right. It's a porous like structure. When the bone's density becomes low, this may cause the osteoporosis. This is the description about the word osteoporosis. Now, this osteoporosis basically belongs with the bones disorder, right. So, bones, muscles and skeleton system, bones, muscles and joints, it totally they form the muscular system, and this is also known as the musculoskeletal system, along with the cartilage, tendons, ligaments and connective tissues. These are the various kind of tissues which are helped for the locomotion or for the framework of the skeletal system. So, this system gives the structural support and the movement throughout the body, right. So, this musculoskeletal system is derived from the, it consists of cartilages, many types of cartilages like hyaline cartilage, costal cartilage, there are various types of cartilages, right, ligaments, tendons and there are the other kinds of connective tissue which are help to form the musculoskeletal system. The part of musculoskeletal system grows, the changes throughout the life, means whenever the person is live, and this process, the upgradation, the formation and the destruction of the bones, it is a continuously process, right, throughout the life. Just like if the person met with any accident or a trauma, so there is some fractures, right. So, the body will recover itself. So, that means, what do you mean by this? This means that the process of the repairing the system is continuously throughout the life. So, injuries and various illness can damage the bones, muscles and the joints, and this will recover by continuous method which will be performed by the body system, right. So, basically the topic of our content is the osteoporosis. Now, first we discuss about what is osteoporosis. So, when we discuss about the osteoporosis, so always remember, osteo always denotes with the bones and porosis. Porosis just like pores, pores in bone, right. Pores in bones mean just like if you know about the structure of the bone, so it is very dense like structure, right. But when the person is suffering from the osteoporosis, at that time what happened, the bones become porous, means the density of that particular bones become very loose, very less, the density is become less, that is why it is known as the osteoporosis. So, osteoporosis cause the bone to become the weak and brittle, So weak, brittle, fragile. What do you mean by fragile? Fragile means whenever the person is met with an accident, met with a trauma, so just suddenly what happened at that time, the bone break, right? The bone very easily break or fractured, right? Just with a mild injury or the accidents. So why this happens? Just because of this osteoporosis. So this brittleness that fall, even a mild stress such as bending or over the cuffings may cause the mild fractures. So osteoporosis related with the fractures most commonly occurs in the hip, wrist and the spine. So this osteoporosis basically occur where? The location of hip, wrist or spine, because this is the strongest parts of the bone in which our skeleton system will stabilize at that points, right? Because with the hip portion the person is able to sit in the proper manner. Wrist, the motions of any gestures is just done by the wrist. Spine, it's a back part, it's a backbone of the body, right? So whenever person is lay down or it's met with an accident, so at that time what happened? At that time these area, especially these area are injured just because of low density of the bone, right? The low density of bones means at that condition there is the pores forms inside the bones. Pores forms means the density becomes very low. Just because of this low density the bones become fragile. Just remember this concept, right? Now bone is the living tissue that is continuously being broken down and replaced by the formation of calcium, deposition of calcium, phosphate and other minerals which may help in the formation of the bones. So bones is the type of, basically if we talk about the which kind bones is comes under which category. So bones is comes into the connective tissues category, right? So bones is a living tissues that is that is continuously may break down and they replace with the deposition or the re-establishment of the different types of minerals which may be used during the formation of the bones. But in the case of osteoporosis it's just vice versa, right? What do you mean? What in the osteoporosis what happened? When the bones become fragile or the bones become fractured, at that time what happened? At that time the process of remodeling is not done, right? Just because of there's a various pathways we will discuss about later. So there's a various pathways by which the bone cannot form their shape properly, right? So osteoporosis occurs when the creation of new bone doesn't keep up with the loss of old bone, right? Now basically if we talk about what are the symptoms, right? What are the symptoms behind the osteoporosis? So basically osteoporosis, the word said osteoporosis means the bones become first of all fragile, the person feels very weak, pain throughout the body without any significance, right? So basically the symptoms are typically there is no symptoms in the early stage, but early stage of bone loss, but once bones have been become weakened and the osteoporosis, this might have a signs and the symptoms of which include like severe back pain which is caused by the fracture or the collapse of the vertebrae. Means when the person is suffering from the severe back pain, it may be from the fracture or it may be when there are the various type of vertebrae columns just like cervical, thoracic, lumbar, sacral or coccyx. Just because of any condition just like the the location of lumbar, that is L3, L4, L5, right, they may be collapse, they may be attached with each other, right. So at that time the person feels so much high pain throughout the back, right. Now loss of height over time means, loss of height over time means the person is very heighted, and due to this the bones can't be properly formed, or the nutritions or the minerals can't deposit at that time. The stooped posture, the person is when they take the other's posture throughout the body, then they may be fragile. The bone that breaks much more easily than expected. So in the osteoporosis, the bones easily break down without any reason, without any cause, just because of any mild or any mild accident, right. So these are the symptoms of the osteoporosis. Now pathophysiology of the remodeling, first of all we discuss about the remodeling. So what is remodeling? Remodeling means when the bone get break down just because of fracture, just because of any trauma, so the bone will reform again and again in the proper shape, right. This process is known as the remodeling. Remodeling means the bone is just break down just because of fracture or some other kind of accident, and at that time what happened? At that time the body is continuously reheal the body and try to reshape the bones in the original form with the help of different kinds of mechanisms into the bone formation. So here is the two words, that is the osteoblast and osteoclast. First of all we discuss about what is osteoblast, what is osteoclast, right. Blast means, you always thought that blast means just break down, right, but here there is another thing. There is a blast means the formation, and clast means is the breakdown, right. So osteoblast means formation and osteoclast means breakdown, right. So in the condition where the bone the condition where the bones gets breakdown, it's breakdown. So there is a process of pre-osteoclast. Here the resetting of the bones from the surface, here the resetting of the bones from the surface, then active osteoclasts try to reabsorb, and this mononuclear just divide, or its reversible process. At the end again the osteoblast try to form the bone, right. What is osteoclast? Osteoclast just they are the agents which, osteoclast is the agents which are not try to, or they are not able to form the bones, they are just vice versa of the osteoblast. Osteoblast is the formation of the new bones, or osteoclast is the destructions of the bones, right. The osteoclast and osteoblast is a continuously process. Why? Because if the bone is continuously forming, because there is a excess deposition of a calcium or the minerals which may be, which are help in the formation of the bones, it is continuously process, right. So what happened at that time? At that time the bone get irregular in shape, right. So the osteoclast what they do? They just shape out the bone, They just shape out the bone at a particular area, they just remove the excess content of the bone at that particular area. Due to this, what happened at that time? The bone gets their original shape, right. So, here the pre-osteoclast means the formation, they are trying to restoring the bone surfaces, then osteoclasts are active just because of remodeling, and this is a mononuclear cells. Then the cells will try, then these cells will try to form the new bone, that is a formation of new bone. And now at the last one are osteocytes. These osteocytes are the cells which are help in the formation of the bones. These are the osteocytes. Osteo means bone cells which are help in the formation of bones with the help of the mineralization. Mineralization means they are the different type of minerals which are used during the formation of the bone. Now, this is in the presence of the parathyroid hormones, that is a catabolic. Catabolic means this is a breakdown process, right, and this is the anabolic process in which the bones will form. So, this is the pathophysiology of the remodeling. Now, this is the concept behind the osteoclast or the osteoblast, right. So, there is a rank, right, there is a receptor that is known as a rank, and this is known as a rank receptor ligand pathway essential for osteoclast activity, right. Why? Because if the osteoclast activity does not perform, so what happened at that time? The bones continuously form and that condition the bones becomes irregular in shape, right. So, this rank pathway is important just because of the proper structure of the bone. So, this rank ligand is essential for the osteoblast for the formation, function and the survival of the body. Now, basically rank is the receptor by which there is a ligand by which this is bind. They bind to their receptors and they perform their activity, right. So, now start from the reasons behind this osteoclast may be growth factors, hormone and cytokines. What is growth factor? Growth factor means the growth factor is the checkpoints where these are the checkpoints which can define the proper shape, size of the body, right. Hormones, in the previous slide I told you that the PTH hormone is responsible for the osteoclast processes. Now, cytokines is also a process, is also include in the process of the osteoclast. Now, these are the main factors behind the osteoclast activity. So, what happened that time? The osteoclast means there is a formation of the bones continuously, there is a formation of the bones. So, this is a bone, this is a rank, right. This is a rank, this shows the this symbol shows the rank, right, and this structure shows the ligands, rank ligands. What they do? They just attach, they just form the series, they just bind with the rank. And what happened at that time when they attached with this CFUM, then they prefusion of the osteoclast activity. Prefusion means now they are get ready for the proper reshaping of the bone. Now, multinucleated osteoclast, there is a multinucleated osteoclast means there is a cells which are there again they are divided, this process of the osteoclast process, and finally the activated osteoclast. When the osteoclast is activated, then what happened at that time? They just try to reshape or remodeling of the bone. So, basically the concept is when in the process of the osteoblast, osteoblast is the process in which the bones continuously form, right. So, what happened at that time when the bones is continuously formed, they forms excess or the irregular shape of the body. So, for stop this irregular shape of the body, there is a process of osteoclast, and this osteoclast is done by the two kinds on, there is a rank, and this rank binds with their receptors. So, when they binds with the receptors, the process of the osteoblast is stopped, right. The process of the osteoblast is stopped, and at that time the process of the osteoclast is start. So, this is the rank receptor ligand pathway which is essential for the osteoclast activity. Now, secondary osteoporosis. So, secondary osteoporosis occurs when underlying the disease, deficiency, drugs, osteoporosis. Secondary means it is just because of any other condition. Primary osteoporosis means it is just because of the demineralization, just because of lack of minerals, lack of calciums. So, at that time bone density become loss, but secondary osteoporosis is just because of any other kind of disease or treatment the osteoporosis may occur, that is known as the secondary osteoporosis. So, secondary osteoporosis occurs when underlying this disease, deficiency or the drug cause osteoporosis up to the 1/3 of the menopausal women, and as well as many men and the premenopausal women have a coexisting cause of bone loss, of which is a renal hypercalciuria is the one of the which is the most important category of the secondary osteoporosis. Means the person, if we talk about the female candidate, if we talk about the female patient, so at the time of the menopause or the time of post-manual or the post or the pre, then the condition of that condition, there is an excess loss of the calcium through the urine. So, that is why the bone density becomes low, right. So, there is a secondary, why this is called secondary, but just because of post and pre menopausals. Now, risk factor. If we talk about the risk factor of the osteoporosis, so basically first of all genetics. Genetics is the main, or it's one of the more important risk factor of the osteoporosis. So, genetic factors such as family history of the osteoporosis, amenorrhea, early menopause, post menopause state, physical inactive, and immobilization means the person is physically inactive or he or she will be not able to move. So, that means maybe just because of the low density of the bone. Now, use of certain drugs just like the anticonvulsant drugs, systematic steroids, thyroid supplements, heparins, chemotherapeutic agents, insulin. There's a lot of series of drugs. There's a lot of drugs which may be cause the osteoporosis, right. Now, alcohol and tobacco use. So, alcohol and tobacco use may be cause the osteoporosis, androgen and estrogen deficiency, and the calcium or the vitamin D deficiency is the most important, because just because of this calcium and vitamin D deficiency, the bones will not able to reform again after the injury, right. Now, if we talk about the treatment, so clinically clinicals should offer the pharmacological treatment to women with the known or the osteoporosis to reduce the risk of hip and the vertebrae fractures. That is aldronate, resedronate, zoledronic acids and denosumab may be used just in the condition of the females in the risk of the hip and the vertebral fractures, just because of after the menopause or during the pre-menopause condition, the person body become weak just because of many hormonal changes, right. Now, the post-menopausal women, estrogen or estrogen plus progesterone or the uh, raloxifene should not be used for the treatment of the osteoporosis. In the male with the clinically recognized osteoporosis, clinically should offer the biphosphonate therapy to reduce the risk of vertebral fractures. Evidence is lack on the BMD monitoring the men. So, these are the some kind of drugs which are used during the treatment of the osteoporosis in the men as well as in the women. Now, gout. So, basically gout is the inflammatory arthritis. So, gout is basically used gout is just because of the hyperuricemia, means uric acid is basically deposited into the small joints into the body, and due to this the person feels so much pain into the area of the area of the joints where the uric acid will be deposited. So, gout is just due to the presence elevated level of uric acid in the blood, and this occurs from the combination of the diet and other level. The crystal deposit into the joints, the crystals of uric acid. And now, symptoms, if we talk about the symptoms, so basically there is a intense pain, in joint pain, discomfort, inflammation, redness into the swelling into the area of the deposition of the uric acid. Complication, in some cases gout can be developed into the more severe condition, just like including the kidney and the renal stones. Risk factors, so risk factors just like a sex, just as male and female candidate, genetics, lifestyle, weight, renal insufficiency. So, there are the various kinds of the risk factors. So, basically here we discuss about what is the uric acid production and the how it will excrete out. So, basically the DNA and RNA are the purines, right. So, these purines are converted with the help of PRPP in the hypoxanthines, and this hypoxanthines is converted into the xanthines in the presence of the xanthine oxidase, and this xanthine oxidase converted into the uric acid in the presence of xanthine oxidase, which is low soluble in water, and this xanthine oxidase converted into the uric acid, and this uric acid may call the hyperuricemia, gout, deposit of the urate crystal, nephritis. These are the some conditions where the uric acid will deposited. Now, if the uric acid is high into the blood, at that time what happened, this react with the sodium, and the sodium crystals deposit into the soft tissues, that is the joints, and they may cause the inflammation, and this infiltration of granulation of the phagocytosis of the urate crystals then generate the free radicals, and these free radicals will damage the tissues of the joints. So, this is the pathophysiology of the uric acid, gout. Acute gout, acute means when the pain is sudden onset and they are just stop after some time. So, this may occurs into the area of ankle, knee, elbow, wrist. This is a short. Now, chronic means there is a frequency attacks with increased intensity, and this is continuously throughout the long period, which may cause the joints, and this is the severe pain into the joints with the many deformities into the joints. Now, treatment, if we talk about a treatment, so for the acute gout, NSAIDs means any anti-inflammatory or anti-inflammatory drugs, corticosteroids, colchicines, and for the chronic gout, there is a inhibit uric acid synthesis, that is the most important, as the allopurinol and the fabiquinate and the probenecids and the sulfapyrazoles. So, these are the drugs which are used into the treatment of the gout. So, these are the drugs how the allopurinol will act. So, this allopurinol what they happen, they just stop the synthesis of the xanthine oxidase, and when the xanthine oxidase will not formed, so uric acid will not deposited into the joints. So, due to this the gout will be treated. So, this is all about the osteoporosis, gout and their treatments. Thank you.